When should women begin screening for breast cancer?
So for women with average risk breast cancer, we recommend starting to screen at age 40. This is when screening has been shown to have the most impact on survival. Average risk simply means that women do not have any additional red flags for developing breast cancer. So that is women who do not have any strong family history of breast cancer, women who do not have any known genetic mutations, and women who have not had any prior history of radiation therapy for something like lymphoma. Basically, it's most women.
So that list that you just read off, that would put someone at a higher risk.
Correct. That those patients would be considered at higher risk. In addition to that list would be someone who have dense breasts or prior biopsy that showed high risk. And those patients are likely to benefit from additional screening and earlier screening. Sometimes screening can begin as early as their 20s or 30s. And those women usually have additional screening tests.
How does a woman know if she has dense breasts?
Good question. So a lot of states, including Michigan, are now required to let women know on their mammogram reports if they've had dense breasts. And dense breasts is a little bit of a two-factor thing, because it obscures the image, which makes detecting an early breast cancer a little bit more difficult. And having dense breasts in itself increases the risk of developing a breast cancer. Most women's breast density change with age, and it's more related to your level of estrogen more than anything. Most women with dense breasts, as they get older and postmenopausal, their dense breasts start to get replaced with fat. The glands kind of start to degrade and become replaced with fat.
For women with dense breasts, what extra steps can they take to improve early detection?
This is when the supplemental imaging comes into play, and things like ultrasound and MRIs are crucial for women with dense breasts.
I wonder if insurance programs always cover that?
That's a good question. They do, and different insurance companies have different criteria of when they would cover an additional MRI and when they would not. There's different levels of breast density. It's not a binary of dense or not dense. There's different levels of breast density. And at the highest levels, usually insurance companies will cover an MRI.
Are there ways to make screening more personalized instead of kind of a one-size-fits-all approach?
Yeah, absolutely. And I think this is how the field is headed. We now have some risk assessment tools or calculators, if you will, that take into account things like family history, genetics, lifestyle. And it takes all that information into account to determine when to start screening and what type of modalities to use.
So women who are diagnosed with early stage low risk breast cancer, is it always necessary to pursue aggressive treatments?
No, not always. I think treatment has become more and more personalized over the last really couple of decades, and we keep making strides in that direction. We now use things like genomic assays to determine how likely is the tumor to behave aggressively, how likely is it to metastasize or spread, and how likely is it to respond to the aggressive treatments such as chemotherapy. And for women who have low scores, they can safely avoid things like chemotherapy. We also have smarter hormone therapies, and radiation techniques have become more precise and smaller and shorter over time. So you take all that into account, and the treatment de-escalation have taken several steps in the last decade or two.
So you've been at this for a little while. You've probably seen a lot of changes then since you were in medical school.
Yeah.
In the way breast cancer is treated.
It's changed quite a bit. As a matter of fact, just from breast radiation alone, it moved from being 6 weeks of radiation treatments to now we do as little as 1 week. And that's just over the last 15 years or so.
I talked to one of your patients, and she was interviewed, and a couple things that popped out with me. She's 40 years old, and she said she was so surprised by the diagnosis because she didn't feel a lump, and didn't have anyone in the family with cancer, and her presumption was that it's very hereditary. So can you speak to that? Because there is certainly a lot of folks out there that don't work in the cancer business like we do, and they don't necessarily have the knowledge. So what would you like to say to them about what they need to know?
Right. This is one of the most common misconceptions out there, is that you have to do something wrong in order to develop cancer, or you have to have a very strong family history to develop breast cancer. Truth is, breast cancer is the most common cancer diagnosis in women. 1 in 8 women will develop breast cancer. 1 in 8. That is a huge number. That means that the majority of women who will get diagnosed with breast cancer do not have family history of breast cancer. And so that's why screening is important, and we screen everyone starting at age 40, even if there is no risk factors. Women with risk factors and above average risk, such as family history of breast cancer, those are the women that we start screening even sooner for. And so, again, I go back to this 1 in 8 women will develop breast cancer. That figure, I think, says it all.
How does a woman know when she should go maybe get genetic screening, and whether the testing might be suitable?
I think if you don't have a strong family history of breast cancer, then there's no reason to get genetic testing. Usually we recommend genetic testing when someone is diagnosed, and we do a family history and we assess. We feel that there's a cluster of cancer diagnoses or unusual cancer diagnoses in their history and family history, and those are the patients that end up getting genetic testing. But if you don't have that strong history in your family, then doing the screening is usually sufficient.
After treatment, of course, many women worry about recurrence. I think anybody who gets cancer worries about a recurrence. What progress is being made right now to improve long-term survival and just give people peace of mind?
So this ties back to the advancements we've made in the genomic assays and selecting out for the patients who have a higher risk of recurrence in order to intensify the therapies for those, and then de-escalate the treatments for the patients who have a lower risk cancer. And between the targeted therapies that are being developed, the smarter hormone therapies that we have, the more precise, smaller radiation volumes and shorter courses of radiation, between all of these factors, we have personalized the treatments and made it less and less likely to have a recurrence. But of course, follow-up is important. Just because you have treatments for your breast cancer doesn't mean that you can go on without any follow-up. And so we emphasize the medical follow-up, and just as importantly, there's survivorship programs, which focus on, in addition to the medical follow-up, they focus on mental health, emotional health, exercise, nutrition, lifestyle. It's not just about living longer, it's also about living better.
Okay. So what new developments in breast cancer are you most excited about?
There's quite a few. As we mentioned earlier, there's the shorter, more precise courses of radiation therapy. There are things like liquid biopsies, which are basically a blood test that can detect small fragments of tumor DNA in the blood to detect for tumor recurrences. There's also AI-assisted mammograms, which improve the detection of small breast cancers on mammograms and reduces misses essentially. And those will help us with early detection even further. The earlier we catch the cancer, any cancer, the higher the chances of cure are. And breast cancer is one of those cancers where we do have a good tool, screening tool, to catch it early. And consequently, the vast majority of my patients are actually cured, the vast majority. And so this puts an exclamation point on the importance of screening.
So hopefully a lot of women will be watching you right now. What would you like to say to women of age who are, nearing the time where they need to think about getting screened, or they're already screening about breast cancer? This is your opportunity. Take it away.
So I would say, first and probably most importantly, I cannot emphasize screening enough. Sometimes patients' fear prevent them from screening, and that can only lead to worse outcomes. I don't want anyone to bury their head in the sand. Get your screening done. Secondly, don't compare cases because no two cancers are the same. And there's a lot of misinformation on the internet. So if you have any questions or concerns, talk to your doctor, and be really careful about the sources of information that you use.
Well, you even had an example about that. So if somebody is going online and starting to Google, what do you recommend if they just can't help themselves?
Again, if you look at the source that you're reading, if you're reading something from a reputable large hospital system, and we don't need to name names, you're probably okay. Or things like the American Cancer Society, those are safe sources of information. And if you have any further questions that are more specific to you, then you need to talk to your doctor. I would say stay away from blog posts and stick to reputable sources.